Hello everyone. In this presentation, we will discuss briefly about the schizophrenia. So prior to that, we need to understand what are the psychotic disorders. And psychotic disorders are the mental illness which are characterized by the difficulty in the reality testing. So what is the reality testing? It is the ability to differentiate from the self-generated stimuli from the external stimuli. Self-generated stimuli can be thoughts, imagery, and feeling from the external stimuli like a perception, and assign the appropriate meaning to based on the experiences which are affected in the patient with the psychotic disorder. So schizophrenia is one of the severe chronic psychotic disorder with lifetime prevalence of about 1%. It is a disorder of the brain development which occurs in the early brain development, maybe around or before birth, late development around or the prior to the onset of psychosis. So there are five major domains of the impairment. First one is the perception, can be characterized by the hallucination, that is a perception without stimuli, belief delusion, fix, false belief despite of having the conflicting evidence, then thoughts like a disorder thoughts or speech, motor disorganized motor behavior, emotions like a flatten affect, anhedonia, asociality. So these are the five domains which are affected in the patient with the schizophrenia. So Liddell tried to cluster all the psychological correlates and cerebral correlates of the schizophrenia in subsyndrome, which is known as the subsyndromes of the schizophrenia. So we will briefly discuss what are the syndrome, symptoms, impaired psychological performance, and the regional cerebral blood flow correlates. So first syndrome is a reality disturbance, which are characterized by the symptoms like a delusion, hallucination. There is a psychological performance impairment that is in the self-monitoring, and regional cerebral blood flow correlates for these are the left medial temporal cortex and cingulate cortex. Then disorganization is characterized by the formal thought disorder, inappropriate affect or bizarre behavior. Psychological performance that are impaired are the test of the selective attention, and the brain region which is involved is the anterior cingulate, right ventral frontal cortex, bilateral parietal region. Psychomotor poverty is characterized by the flat affect, poverty of speech, decreased spontaneous movement. Psychological performance affected are the word generation task, planning test, and the regional cerebral blood flow correlates are the underactivity of the frontal cortex. So, to understand the schizophrenia, we have to measure the brain in terms of the structure, function, connectivity, chemistry, and genetics uh, to understand the schizophrenia. So we will begin with the brain structure. In brain structure, we usually measure the gray matter, white matter, tract, synapses, and neurite integrity. And the imaging modality which are used are the structural MRI, diffusion tensor imaging, and the frequently reported finding in the schizophrenia are the widespread gray and white matter deficient, in particular prefrontal and temporal region and larger ventricular. There are the approaches to understand that includes the machine learning approach like a NODI, neurite orientation, dispersion density imaging, synaptic vesicle imaging, high field MRI, and safe analysis. So brain function, for that we have to measure the cerebral blood flow, resting state brain function, task related brain function, and neuroinflammation. Imaging modality are the PET, SPECT, and frequently reported finding in the schizophrenia includes prefrontal hypoperfusion, altered function in the of the default brain mode network, altered task-related activation of the prefrontal and temporal region. Approaches are the pseudo-continuous ASL and free water DTI. Brain connectivity we measure with the long and short connectivity connectome organization. Imaging modality are the fMRI at DTI. Frequently reported finding are the decreased long and short range connectivity, reduced connectome efficiency, altered modularity, and approaches are the graph theory approaches. So for brain chemistry, we usually measure the dopamine, serotonin, glutamate, GABA, neutrophil integrity, neutrophil synthesis, and metabolism. Imaging modality are the PET, PET-MRS, and frequently reported finding in the schizophrenia are the increased presynaptic dopamine, variable alteration in the regional glutamate and GABA level, reduction in the N-acetyl aspartate, and alteration in the membrane phospholipid metabolite, and approaches are the high field MRS, neuromelanin MRA to investigate the dopamine. Brain genetics measures are usually multifactorial, polygenics, involving the genetic analysis as well as MRI. Imaging modality are the structural MRI, DTI, commonly reported in schizophrenia are the common variant are associated with the hippocampal and intracranial volumes, and approaches are the we called it as imaging genomics. Thank you very much.